Hello, my name is Nawaida binti Omar. Today I will be presenting about my study of antimicrobial activity of Anadrol granosa shell-based hydroxyapatite. Firstly, I will present my introduction and then my problem statement and then my research methodology. Anadrol granosa, or also known as blood cockle, is a shellfish found in a Southeast Asian coastal region. Its shell is rich in calcium carbonate, making it a potential biomaterial for bone regeneration. The shell is high in calcium content, offers an environmentally friendly and cost-effective solution for producing hydroxyapatite, a material used in bone regeneration. By utilizing the shell of blood cockles, we can recover valuable resources from waste while providing an easily accepted and affordable option for bone-related medical procedure. Furthermore, the blood cockle contains chitosan, a substance known for its antibacterial properties and ability to accelerate wound healing. Chitosan, present in significant amount around 40 to 50% in blood cockles, can be extracted and used as biocoating with antibacterial benefits. Its biocompatibility and immunogenicity make it a promising component for promoting the healing process. The utilization of blood cockles not only contribute to sustainable waste management but also offer potential advancement in medical application related to bone regeneration and wound healing. For hydroxyapatite to be used as biomaterial, it has certain criteria that must be met, including biocompatibility, biodegradability, low toxicity, bioactive, osseointegration, and osteoconductivity. They also need to have enough porosity and mechanical property for the application of the material. Now I will present about the problem statement. Infection in bone tissue after surgery often occur due to foreign bodies. Gram-positive bacteria such as S. aureus are most common bacteria. These bacteria produce fibronectin-binding proteins that allow them to attach surgically implanted bone implants. Some bacteria form a protective biofilm, making them resistant to antibiotics and leading to persistent bone infection with high antibiotic treatment failure rates. Gram-negative bacteria like E. coli have also become more prominent as causes of bone infections. Despite their lower prevalence, gram-negative bacteria are clinically important due to their complex antimicrobial properties. Therefore, it is crucial to study the antimicrobial properties of hydroxyapatite, a potential biomaterial for treating bone disease. Understanding how hydroxyapatite inhibits bacteria can help in determining its suitability as a treatment option for bone-related infections. The objective of my study is to synthesize the HAP from the shell of Anadrol granosa and also to determine the effect of HAP on gram-positive and gram-negative bacteria. This is the flowchart of my study. Firstly, we extract the calcium carbonate from the Anadrol granosa shell by crushing and grinding the shell to obtain calcium carbonate powder before drying the powder inside oven for 3 hours. And then the HAP is synthesized by wet precipitation method. The calcium carbonate obtained from Anadrol granosa is used as the calcium sources and the phosphoric acid is used as phosphate source. The pH of the solution is maintained at 11 throughout this process by dropping sodium hydroxide solution dropwise. And then the solution is let to age at room temperature for 24 hours before we centrifuge wash the solution to obtain HAP gel. The gel is then put into oven to get HAP powder before it undergo calcination process for 6 hours. And then the HAP powder is then characterized by SEM, FTIR, and EDS. SEM is used to study the morphology of the HAP particles. FTIR analysis is performed to identify the functional group of the HAP powder. Meanwhile, EDS spectra is used for the elemental analysis of the HAP powder. After the characterization, we can conclude if we have obtained the HAP powder or not. And then we can proceed with the antimicrobial test by using Agawa diffusion method. In this test, we implant the use of S. aureus and E. coli as the gram-positive and gram-negative bacteria. In this study, we use antibiotic amoxicillin as the positive control and distilled water for the negative control. The plates are incubated at the temperature of 37 degrees Celsius for 16 hours. So that is all for my research methodology. Thank you.